Hello, my name's Saad Laws, and I'm your librarian for the ANCC clerkship. You'll be entering the simulation lab soon, and it's safe to say that you'll see cases and scenarios that you're unfamiliar with. But in addition, you'll also have information needs that you'll need to address. If you haven't considered how you're going to do this, now is a great time to start. But before we get to that, let's take a look at what not being prepared for your information needs might look like.
I think we need to intubate. Does anybody know what to do?
I think we need to give the patient a sedative, but which one and how much?
I don't know which one. Can you look it up?
Sure, let me just Google this. So, how to intubate a patient, or what sedative we need to intubate a patient, I think. So there's Mayo Clinic, there's Midland Plus, there's Ahmed's Airway Barn. Okay, it doesn't seem right. There's so many of them, none of them actually seem to work. What do you think?
So what do we give the patient then?
Oh, this is taking too long. I think we need to paralyze the patient. I don't know what to use. Can you try to find out which one we should use and how much and what's the dose? And this time, try to not use gold.
Okay, sure, I got this. I think up to date, because we can't go wrong with up to date, right? So intubation, let's see. So there's direct laryngoscopy and endotracheal intubation in adults. There's rapid sequence intubation outside of the operating room in children. We don't have children. There is rapid sequence intubation for adults outside the operating room. I think this could be the one, right? Okay, let's see. There's intro definition indications. I think I'll go for indications. So it says rapid sequence intubation is the most common emergency method for securing control of the airway in critically ill patients not anticipated to be difficult intubations. Many studies have demonstrated the benefits of RSI in critically ill patients with improved first pass success.
What are you doing? Reading a book? We just need a medication, dose, and route.
Okay, hold on. It's got to be here somewhere. I'm pretty sure I can get to this.
Wow, that was shocking. Not being prepared for your information needs can be a real hindrance. Now, let's take a look at what being prepared might look like.
I think we need to intubate. Does anybody know what to do?
We've already oxygenated the patient. I think we need to give him a sedative, but which one and how much?
Yeah, I'm not really sure which one we should use. Can you look it up, please?
Sure, let me look it up in WCM. So our patient is 70 kilograms. So we're going to need to give him etomidate, 0.3 mgs per kilogram IV.
Okay, so we'll give him 21 milligrams of etomidate IV. So now let's move on to the paralytic. Can you look it up, please, Ahmed?
Sure, just give me a second. So for 70 kilograms, you can go for succinylcholine. We can give him 1.5 mgs per kilogram IV.
Okay, perfect. So give him 105 milligrams of succinylcholine IV.
Okay, I'm ready to intubate the patient.
From these two examples, you can see how important it is to have access to good information resources. As you begin to develop your information strategy, there are two tips that you can take with you. First, talk to those people around you. Talk to your fellow students, talk to residents, talk to consultants. Ask them what information resources they use that work well and why. Secondly, as you begin to evaluate different mobile apps, there are several things you'll want to consider. First of all, consider how easy it is to navigate the app and find the information that you need when you need it. Think about the information that's being presented to you as well. Is it quick and concise, or is it meant for more in-depth study later on? You'll also want to consider whether you need an internet connection to use the app, or whether you can use it offline. Finally, consider how up-to-date the app is, and how often you'll need to update it to use it. One thing I would suggest as well is that once you find several apps that you think will work well for you, is that you should take them on a test run before you enter the simulation lab or into the clinical setting and find out how they'll work. With these tips in mind, finding the information you need when you need it will be simple and easy.